Hi there, it's Justin Lubino with Senior Advisors, and today is Thursday, October 10th, 2019. I'm excited to announce the new Medicare Plan Finder tool has released a new feature which we've been asking for since it was launched, and we're very excited that it's now available, and it was available as of yesterday, and it's the total cost calculator and sort function, which basically calculates the total drug cost plus the premium for the entire year and allows us to sort all of the 26 or 30 different drug plans based upon that total cost figure. That was the number one most important function of the old Medicare Plan Finder, and now they've added it to the new Plan Finder, which we're very excited about, and it will save some time with doing these recommendations and the analysis for the drug plan. So I want to do a quick walkthrough of the new tool and show the new total cost calculator and how it works. So if you go to Medicare.gov, there's a blue button on here for Preview 2020 Plans, which will take you into the new Plan Finder. And you can go through either an authenticated flow, which means you're going to log in with your mymedicare.gov account, or you can create an account. And if you're going to be saving your drug list for future reviews in future years, you definitely want to use that login or create account function. For the purposes of this demo, we're going to go without logging in just to show you without anyone's personal information. We can do the anonymous flow without logging in. Now, if you're doing it without logging in, you will not be able to save your report or save your list. You'll have to re-enter everything if you go back in the future. But again, for the purpose of the demo, we're just going to do the anonymous flow. The first question, what type of plan are we looking for? We're looking for a drug plan for this example, and we're just going to enter in our office zip code here, and it'll pick the county. And then the question is about, do you get any extra help? And for the purpose of this example, I do not get any extra help, and we click Next. Now, do you want to see drug costs? So yes, we want to see drug costs. That's why we're looking at the report here. And we're going to look at both retail pharmacy and mail order, and click Next. And this is where we're actually going to enter in the drug information. And you'll see it starts to pre-fill the list as you type in a few letters. This individual is on 3 medications, so we're going to put in Restasis, which is an eye drop, and it's going to default the most popular dosage, and it's a one package of 60 eye drop containers every month. Add to my drug list. We're going to add another drug for cholesterol medication, a pretty popular generic cholesterol medication, and add that to the list. And we're just going to take the default quantity, again 40 milligrams in this case, once a day, which is 30 per month. If you have a different dosage, you can select that here as well. Add to my drug list. And the last drug for this individual is Celebrex, but we're going to hit the add drug, and it gives us a generic available, which we want to use. This individual takes the generic, so we're going to hit add generic. And then the dosage, we'll take the default dosage here as well and add to my drug list. So these are the 3 medications in the drug list that we're going to be looking at. We next click Done, and we're going to select our pharmacies. This individual likes to go to either CVS or Walgreens, and we can also include mail order. If you do not want to use mail order, you can actually uncheck that, and you can pick another pharmacy as well to do a cost comparison. So after the pharmacies, we click Done. Now this is going to be the plan results page, and this is where the big change that was just implemented is showing up, and this is what allows us to really do these reviews each year. Basically, what's just happened is the tool has calculated the total overall cost projected for the year. That's the premium plus the cost of the drugs for the entire 12 months, and it basically sorts the list based upon that lowest drug and premium cost information. So, the one at the top of the list is the least overall expense, and we're really going to focus on this number right here. This is the retail pharmacy cost. The mail order cost is here as well. They're still working on some kinks with the mail order pricing, so for now we're going to focus on the retail cost. But basically, as we scroll down through the list, you're going to see this number is going to continue to increase. So the lowest overall cost happens to be this Mutual of Omaha plan, and the total number is at $1,800 or $1,783 for the year. If you scroll down, the next one is a little bit higher, $1,813, and again, this includes the premium plus the drugs. The next one, $1,822, $1,860, and so on and so forth. $2,300, $2,300. And if we keep scrolling all the way through, if we go to that very last plan, you can see how big of a difference the cost is. This is for this example, for these drugs this person's taking, this is the worst possible plan. Look at the total overall cost for the year. Remember, the best plan was a little less than $2,000. The worst one is almost $10,000 more for the year. And the reason is the most expensive drug on this list, which is the Restasis, is not covered on the formulary for this plan or even for this other plan. See, here's the irony with these Part D plans. This is another Mutual of Omaha plan. The number one plan on the list happened to be Mutual of Omaha Value, which has a lower premium. It's $24 a month. This plan has a higher premium, $56.80 a month. But that Restasis is not covered on this plan, and it is covered on the lower premium plan. That is very important. Do not pick a drug plan based upon the premium. You got to look at the total overall cost. That's why this tool is so valuable, because even though the premium's higher, it doesn't necessarily mean it's a better drug plan. It's very specific to the medications that you're taking. All right. So I'm going to go back to that best plan so we can look a little bit deeper into that. Again, that's just the best plan for this drug list. It happens to be Mutual of Omaha RX Value. And if we click on plan details, it'll give us some more information. You'll see the premium is $24.90 a month. The deductible is $435. That's really for higher tier medications. And the cost for these three drugs is in this table, the atorvastatin, the Celebrex generic, and the Restasis. You can see the full retail cost of each of these, the cost before the deductible. So really the one that the deductible is going to apply to is really just that Restasis. I guess the Celebrex as well if you get that before the Restasis. But you're going to hit that $435 deductible in that first month. And then after that, this is the cost after deductible. So this is basically the copay that you'll pay each month for those drugs, which comes out to about $51 a month after the deductible. And then the other two columns here, this is if you reach the donut hole. It's also called the coverage gap. You'll basically pay 25% the cost of the medication. This individual is going to reach the coverage gap, so we'll talk about that in a minute. So basically, their drug costs will increase when they get to that donut hole, which will happen around July. And then if they were to get to the, this is called catastrophic coverage, or the coverage after the donut hole, they'll only pay 5%. So they're not stuck in that donut hole all year if they have very expensive medications. And we have other videos out there that explain how this donut hole works. But for this example, this person is likely to reach the donut hole, and it's likely to happen around July. So this table shows us that first month you're going to have a bigger cost because of that deductible, that $435 deductible. And then each month after that, you're going to pay those copays of $51.50. And then starting in July, at the very end of July, you're going to hit that donut hole. So your cost is going to increase, and you'll be fully in the donut hole starting in the month of August and through the end of the year based upon these medications. And that's where you're paying that $142.29 per month for the drug. So, and then these tables just repeat for the other pharmacy. For this plan, CVS happens to be preferred pharmacy, so there's lower copays. If you look at the next one for this plan, Walgreens is a standard pharmacy, so this individual will pay higher drug costs if they go to Walgreens with this plan. So everything just repeats, but you'll see different numbers for Walgreens. Mail order cost is also in here, but I'm not going to review that today because it's still being worked out, and the pricing is not based upon the preferred mail order pricing. But that is essentially how you use the tool if you wanted to do the analysis on your own to see what is the most cost-effective plan that's out there. You can do that. It gives you a lot of detail about the plan and the drug costs at each of the pharmacies. And it's getting closer functionally to the old tool, which is really a good thing, because of this total cost was really important to be able to figure out what's going to be the most cost-effective plan. So we're really excited. This function was released yesterday, and that's about it. So hope you enjoyed this video. Hope you learned something. And if you have any questions, you can reach us at the number you see above. I hope everyone has a great week. Thanks.